Baby's napping. Shh. I have time to shoot this video. So constipation during pregnancy can be such a pain in the butt. So today I'll share my top 10 tips to help you with that. If you're pregnant and new to my channel, make sure you subscribe and click the notification bell below so you don't miss any of my future releases. Tip number 1 is drink more water. I know this seems like an obvious one, but if you're pregnant, you actually need more water than when you're not. So if you want to know if you're drinking enough water, just look at your urine color. It should be pale yellow, not dark yellow. So if it's dark, you need to increase that water intake. Tip number 2 is check your diet. Make sure you're eating plenty of vegetables and fruits, or add a couple tablespoons of chia or ground flax seeds to your meals in order to improve the intestinal transit. Other foods that can facilitate bowel movements are prunes, prune juice, and coconut water. Tip number 3 is keep active. Being active, especially after meals, can help trigger a bowel movement. So something as simple as like a 5 minutes walk around the block can actually be enough to make it happen, and I would especially recommend it after breakfast. Tip number 4 is use a squatty potty. Being in a squat position helps relax the pelvic floor for an easier bowel movement without straining and pain. There is a product called the Squatty Potty that fits well around the toilet and can be tucked away once you're done. But of course, you can use anything you have at home to bring your knees higher than your hips when you're pooping. Tip number 5 is forward-leaning inversions. So if your bump is getting bigger, it's possible that your baby is simply just pressing on your intestines and causing constipation issues. So doing daily forward-leaning inversions can help taking baby off the guts and facilitate transit that way. So you can check out my video in the description below if you want all the details about how to do a forward-leaning inversion. Tip number 6 is see a manual therapist. Sometimes there can be tensions in the fascia and ligaments around the abdomen, and that can cause constipation issues in pregnancy. A skilled manual practitioner like an osteopath, a pelvic health physiotherapist, or a chiropractor might be able to release some of these tensions to make space around the bowels. Make sure you work with someone who has experience and training working with pregnant moms. Tip number 7 is constipation aid. You can discuss with your healthcare provider what they would recommend for you, but a lot of my clients take magnesium supplements, which can work wonders for constipations, but there's kind of a few types of magnesium, so you really want to check with your healthcare provider which one you should take. And other aids like Restorelax, for example, or Metamucil can also work great, but you need to check first with your doctor. Tip number 8 is work on pelvic floor tensions. So your pelvic floor muscles are around your rectum, right? So if those muscles are tight, it can cause constipation issues. So I will link 2 of my videos that go over the different techniques to release pelvic floor tensions in pregnancy if you want to explore this avenue. And I would also recommend getting assessed by a pelvic health physiotherapist to see if that is your case. By the way, having a tight pelvic floor is not only bad for constipation, but it can also impact your delivery negatively because we want a nice, relaxed pelvic floor for your baby to come through easily and without severe tearing. So I have a full signature program available if you're interested in working on your pelvic floor before delivery to avoid these issues and also have a smooth recovery. So if you're interested, you can just apply on a free discovery call with me in the description below. Tip number 9 is when you gotta go, go. So when you feel the urge to go for number 2, just make sure you don't postpone it. Holding your stool can actually dry it out and make it harder to evacuate it later. So when you feel that urge, just go. Tip number 10 is breathe. Taking nice belly breath after meals can help move the intestinal content along the digestive tract. So it's like kind of a nice massage for your guts just from your breath and your diaphragm. So to do so, put your hands on your bump and try and move it while you take your inhale and feel it coming back towards your spine as you take your exhale. And try to make your exhale longer than your inhale. Repeat this 5 to 10 times, and I would recommend doing it 15 minutes after your meals. Give this video a like if you found these tips helpful, and thanks for watching.